All right, get ready. This is a unpleasant subject, but something that warrants being discussed. We're going to talk about uterine fibroid embolisms. I know. Well, we've got Dr. Ehrman here to tell us a little bit about it from Community Health Network, then also Lisa Staggs, who's a patient. Where do we begin? I guess we start with, what the heck is it? Doesn't sound good.
Well, it doesn't sound good, but it's very common.
Is it?
Yes. At least 30% of all women suffer from uterine fibroids. So it's something that it affects lots and lots of women, 50% of African American women, so very common problem.
Is it painful?
It causes a variety of symptoms. Some of them are things like heavy menstrual bleeding, pelvic pain, can cause pressure, pushing on the bladder, so women can have urinary frequency or urgency. So they have a variety of symptoms.
And then, Lisa, what was it? Obviously, you went through some of those symptoms before you're trying to figure out, okay, what's going on and what plan of attack do we need to implement? So what's your story? What happened?
I had all those symptoms.
Unpleasant.
Yes,
yeah.
It was exceptionally painful. And I had the heavy menstrual bleeding, pleasant subject, and it was a lot of pain.
Okay.
And I had that for about 1.5 years, and I just couldn't take it anymore.
So you went to your doctor, and I'm assuming something like this, you probably got more than one opinion, or did you just get one?
4.
You got 4 opinions, and maybe different solutions from each one, or?
No.
Okay.
Each doctor, with the exception of one, suggested hysterectomy.
Oh wow.
Yes.
That's once you get to that point, that's pretty serious.
Yes.
Okay.
And that's pretty much what most doctors suggest now is a hysterectomy, and that just wasn't something that I was ready to do.
Okay.
So I spoke with another gynecologist, and he said that the uterine fibroid embolism was an option for me. So I did some research, and I found Dr. Ehrman, who's fabulous, and went and had a consultation, and that's what I ended up doing.
Well, so what is the procedure like? I mean, without being too specific, but you know, what happens?
It is a procedure that's done by interventional radiologists, and interventional radiologists are physicians who use X-ray imaging to do minimally invasive procedures. So this is a non-surgical procedure.
Oh, good.
That requires only an overnight stay. We block off the blood vessels going to the fibroid, and so once we kill the flow to the fibroids, that causes the fibroids to shrink and die.
What are the fibroids exactly?
The fibroids are benign, and that's important to let everyone know. They're benign tumors that develop either in the wall of the uterus, can sometimes develop in the lining of the uterus, and they're just made up of benign cells, kind of like muscle cells. Okay. And so they're tumors that get a lot of blood supply, and so when you block that blood supply, that really kills the tumor.
Oh my gosh. Okay, and for a lot of women, they would much rather go through that than say have a hysterectomy. I mean, it's a lot less downtime, and
absolutely.
You want to avoid surgeries when you can.
It's a really good way to preserve the uterus and treat the symptoms, and most women want that. The recovery time is much less than a hysterectomy, and complications rates are less, so it's really a very good alternative to hysterectomy.
And Lisa, after you had the embolism, how are you feeling?
I feel fantastic.
Really?
It's been a little over 1 year, and after about 3 months, I had no symptoms whatsoever. And after my surgery, well, it's not surgery.
We don't call this surgery.
I'm sorry. I'm sorry. After my procedure, the next day I was up and doing things.
Nice.
And I felt great. And now it's just hard to believe that 1 year ago I was in as much pain as I was in.
Right.
And you know, I'd like to state, too, that Condoleezza Rice, this was her procedure of choice.
Oh, really?
Yes.
Okay.
Yes. So
Well, very good. And if people, or if women listening to this right now are thinking, gosh, you know, I have some of those symptoms, this could be me, we're talking about, I could be in that 30%, or in the African-American case, 50%. What do you recommend these women do?
They need to go talk with their healthcare provider.
Okay.
And we will see those patients either from a referral from their healthcare provider, or they can call our office. But it's really important to evaluate them for fibroids.
Okay.
It can be something as easy as a ultrasound. We do MRIs. It's a very good way to looking at fibroids. And so really, if they're having these symptoms, don't think that they need to suffer through them.
Right.
There's really good treatments that don't require surgery.
Nice. So you don't suffer needlessly.
Absolutely.
Well, Dr. Ehrman, thank you so
You're
much.
welcome.
Great information,
Thank you.
Lisa.
Thank you for having
Best of luck.
us.